If you've been told that your child has prediabetes, or maybe you've heard insulin resistance or fatty liver disease, or maybe even high triglycerides, or maybe you've heard something along the lines of we need to just stabilize the weight gain. I want to pause and reset this conversation because, as a pediatrician, I honestly bristle at the way that we've been approaching these problems. So much of the discussion still centers on weight, calories, calorie counting, macros, and just eat less. And that framing actually doesn't explain what's actually happening inside your child's body. Or, truthfully, what do you do next? What we're seeing is biology responding to the environment our children are growing up in. When a child's metabolic health starts to shift, the body often gets stuck in patterns of blood sugar spikes and crashes, and disrupted sleep cycles, chronic stress physiology, truthfully. And one of the biggest drivers that we don't even talk about is our relationship to technology. So much of our children's lives are spent in front of computers or on phones, and this really takes a toll. And it's not because they're bad, it's just the society that we're living in now, but it really does have a lasting effect. It affects things like less natural movement. Normally children would be outside in natural daylight, they'd be playing. More eating without hunger cues, later bedtimes, and also disrupted sleep rhythms because of the blue screens, constant stimulation, and less time to restore and reset, fewer moments where the nervous system is truthfully quiet and settled. So if we want to improve our children's metabolic health, we really have to talk about lifestyle in a real physiologic way, not in a way that creates tension at the table or dread around meals. This is why my approach is different. I'm Dr. Jennifer Davis. I practiced pediatric intensive care for 15 years, and believe me, I understand the power of technology, of numbers, and the importance in the critical and acute stages. But you know what I noticed as children got out of those acute illnesses, out of the crisis, the things that actually supported healing were less technology, more connection, nourishing foods, less nervous system stimulation. All of these things allowed the body to feel safe and then actually move towards healing. This is why I practice lifestyle medicine in general and why I created the Joyful Medicine method for metabolic healing. My approach is evidence-based, supported by the literature far and wide. And it's designed to be sustainable. When we focus on the underlying causes, not just weight. Now, this is shown again and again and again. When we focus on weight, we get stuck in a cycle that actually isn't sustainable and often leads to increasing medications, increasing food, stress, and ultimately more problems in the future. When we focus on the underlying cause, again, not just the numbers, and we lead with abundance and enjoyment, not restriction, change becomes sustainable. So yes, there are foods and patterns that we need to disrupt and reduce, but the most effective place is starting with the things that we're adding. What can I add that's going to help shift biology in the right direction? When we focus on restriction, it's quite the opposite, right? Things become tense, kids become guarded, and parents, we start dreading the next conversation around food. So instead, when we build an environment where nourishing choices feel easier and more natural, this is power. In my practice, what things we focus on are food quality first, not calorie math or perfection, but really food that supports healing, stable blood sugar, and metabolic health overall. We focus on flavor and enjoyment because food only works as medicine when it's enjoyable, right? If it's eaten, then it can really do what it needs to do. Family connection, because kids don't change in isolation. And really, we know that human connection lowers stress, lowers inflammation, and it makes change more sustainable. Restorative sleep, because tired bodies don't regulate blood sugar and growing brains need restorative sleep. Stress and nervous system regulation, because chronic stress chemistry actually worsens insulin resistance over time, which can compound the problems of weight gain and fatty liver, high triglycerides, and all of the things that we're seeing. Not only that, when a calm nervous system resourced, so it's able to make better decisions. So I look at the home as a sanctuary, not in a controlling way, but in a healing way. When we control our home environment, we actually reduce friction and decision fatigue. We can create a space that feels predictable, and restorative and supportive. So nourishing choices don't rely on willpower, they become the default. That's how sustainable change happens. If your family has been given a diagnosis or you've been told to stop the weight gain, or maybe you're just looking for a new approach and you're looking for evidence-based, practical approach that works in real life, this is exactly what I do. If you're ready to go deeper with a clear path around food, routines, sleep, stress, technology rhythms, and a home environment that supports healing, I would be honored to work with you. You can take the next step by booking a discovery call below.